The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you gotta get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
Hey folks, thanks for joining us. This is the Predictive Health Clinic podcast. I am Jack Heald, and I am joined today by Seneca Carrillo, who I met, 3 weeks ago at Low Carb AZ. Seneca, welcome.
Thank you. It's a pleasure to be here. It's good to meet you.
As you know, the purpose of this show is to identify particular health issues that people can either take steps to prevent or to recover from. So, what particular health issue do you want to talk with us about today?
I'd like to kind of address what in medicine, I've been practicing medicine for 25 years now, is more sick care, medication management of healthcare. And I'd like to talk more about tools for keeping one healthy and prevention.
We're going to start over. We are going to start over. I really should have you give a brief bio.
Okay.
Start over. Let's try again. Hey folks, it's the Predictive Health Clinic podcast. I'm Jack Heald, and I am joined today by Dr. Seneca Carrillo, who I met, 3 weeks ago, I guess, at Low Carb AZ. Dr. Carrillo, welcome. If you don't mind, give us a quick bio, and then we'll dive into the guts of the show.
Excellent. Good to be here. Thank you for asking me. So I am an emergency medicine physician, at least trained in emergency medicine, and I've been practicing for about 25 years. And about 3 to 5 years ago, I started to enter this metabolic health space. And I opened up my own, what I call a boutique metabolic health practice about 2 to 3 years ago, where I work one-on-one directly with a cadre of patients who seek me out, specifically looking for help with some of their chronic diseases and chronic illness, but through lifestyle and potential medication management with deprescribing of medication when possible. So this has been super fulfilling, this part of my medical career, although I still work in the emergency department.
And you still work in the emergency department. Okay, so what particular health issue do you want to address today?
So I kind of want to touch on what we do in medicine as being mostly medication management and sick care, and talk a little bit more about tools for health prevention and how, like, all the potential varieties that you can institute as tools to keep yourself healthy through a lifestyle perspective. I'd like to talk about that.
I'm going to translate that into English as best as I can. It sounds like rather than using pills to manage a disease, you want to talk about how to maybe get away from that and actually get healthy.
Correct. Yes.
Did I misstate anything?
No, you got it. I think.
Okay. So how'd you get interested in this? Sadly, that's kind of weird for a doctor these days.
Yeah, I know. And I guess how I got introduced, which was very fortuitous, was through my own primary care doctor, which was I actually had dragged my husband to our PCP, who doesn't like to go to the doctor. And I went with him because I know he's not always forthcoming about his medical issues. And when we were in her office, she introduced me and him to a book called The Obesity Code by Dr. Jason Fung. And she said, hey, this is your homework. I want you to read this. This has got a lot of good information. And we took it home and I read it, and he did not, but I devoured it within a couple of days. And I felt like my eyes had been opened, and that started me down a path. So, Dr. Fung talks mostly about, he talks about insulin resistance, but sort of how to manage it with fasting. So my husband and I did a brief experiment because he was having hypertension issues and we were trying to look at ways to avoid medication. And so he allowed me to experiment with him, and we just did intermittent fasting for a 3-month trial. And I made him get some blood tests done before we started, and then some blood tests at the end of that 3-month period. And it was eye-opening what happened. And this is the issue, is he had a normal fasting blood glucose. And most doctors, that's all they're going to check. And if they saw that, they wouldn't even worry about him from an insulin perspective. But we ended up getting a fasting insulin, which is one of those tests that PCPs don't typically order. But Dr. Fung talks about, and I had learned about as I sort of went down this rabbit hole. And so we got a fasting insulin on him. And normally that should be less than 10. And that indicates that your insulin production is appropriate. And when you have prediabetes or you're having some metabolic dysfunction, that insulin level typically is going to start to climb before you actually develop diabetes, 10, 20 years before that fasting glucose goes up. So his fasting insulin was 40, which is 4 times what it should be with a normal blood glucose. So we started doing intermittent fasting, and it was the sort of easiest version, which is, I like to call it time restricted feeding, where he would just eat in this window of hours during the day, typically between 10 and 6 a.m., 10 a.m. and 6 p.m. We did like an 8-hour window, so it wasn't too difficult. He'd eat his first meal around 10 and stop around 6:30. And then the rest of the day he'd fast. And we did that for 3 months. And he didn't really restrict the food that he was eating while he was eating. And we rechecked his insulin, his fasting insulin at the end of the 3 month. He'd lost 30 pounds just doing that one tool. And his fasting insulin went down to 24, which is almost in half. It's by no means normal, but that was really impressive. And so just seeing those results with that one tool got me just hooked. And I felt like for so long, we didn't have anything to offer patients in ways that they could manage something as debilitating as diabetes, which is connected to so many other chronic illnesses. So yeah, that's kind of where it all started.
Wow. Okay. Normally the question I would ask here is what are the most common misconceptions about this? Folks who have been immersed in the metabolic health field for a while, this is just this is the starting point. But the reality is a lot of folks still haven't heard it. What's the common misconceptions?
I think the big issue is whether it's in the lay media or with your primary care doctors, your specialists, it's all about calories in, calories out. That's how you lose weight. That's how you get healthy. And it's this mantra we hear in our space all the time of, eat less and move more. And that's been touted for decades and it's not working. I think that is the crux of the problem, is that it's one tool that's offered for everyone. And it can work for some people, but it's by no means a panacea. And often it's very unsustainable to be calorie counting and just to try and exercise your way to better health. So that I think is the issue. And if we can start to employ different tools that are sort of specific for different types of people, there's just much more hope in how people can get healthy with their lifestyle management, right? Whether it's nutrition, stress, exercise, sleep. Those are sort of the 4 pillars I look at with my patients. And there's lots of different tools within those pillars that we can tap into. And it's not just eat less and move more.
Okay, so for somebody who's struggling with some sort of chronic health condition, whether it's obesity or all the other things that are out there, let's go down those 4. Let's just start with what's the low-hanging fruit with nutrition?
So most of the time with my patients, we'll start with nutrition. That is the sort of easiest thing to tackle. I think that's the thing that people think they can control the most and doesn't seem as onerous, even though I think it's one of the harder things to sort of continue to do regularly. And so with nutrition, the big tools I'll talk about are carbohydrate restriction. So that's going to be limiting carbohydrates. And this is really in the setting of people who are insulin resistant. And those are the people that are coming to see me. This is the source of most metabolic disorders. And so the goal with insulin resistance is to lower glucose so that we can lower insulin production and resensitize the body to its own insulin production. But in order to do that, go ahead.
Without going too deep into the weeds, describe how someone would know whether they suffer from insulin resistance or not.
So like the example I gave with my husband, you can actually get a fasting insulin and potentially see that your baseline insulin level is being overproduced, which is a state of hyperinsulinemia, which causes insulin resistance. So that is one way. Obviously, there's the disorders of insulin resistance. So if you have diabetes, you have insulin resistance. If you have hypertension, you usually have insulin resistance. If you've had any issues with your heart, you probably have some insulin resistance. And the criteria that make up metabolic syndrome is basically a disorder of insulin resistance. And that includes having an HDL to triglyceride ratio, actually triglyceride to HDL ratio of greater than 3, often greater than 2, is a form of insulin resistance. Your waist size, your waistline measurements for men and women, it's slightly different, but if that's above a certain range, you have metabolic syndrome. Blood pressure. There's 5 criteria. I'm totally blanking on the other 2. But so if you have these disorders, you have a good idea that you have some insulin resistance. But if you're not sure and you think you're doing things pretty well, one of the best labs I think people can get is a fasting insulin. That's going to give them a kind of a gauge better than a simple fasting glucose about where their state of insulin resistance is.
Isn't that interesting that a PCP will not normally test for that?
No, and it's a really cheap test. It's like $7 to $10. So even if you didn't want to have your insurance pay for it, it's pretty cheap to have done. But it's not something we're taught in medical school to look for. It's definitely not something most primary care doctors or even endocrinologists are looking for when they're worried about insulin issues.
I'd love to go deeper down the rabbit hole of insulin resistance, but we will totally run out of time. Nutrition. You said carbohydrate
so we talk
restriction.
About time restriction. Carbohydrate restriction would be one issue because of the insulin component there.
What is that?
Fasting.
What's that mean? What is
time restricted
carbohydrate restriction for me?
So carbohydrate restriction is a variety of whether you are keto, low carb, or you're just trying to cut back on some carbohydrates, right? So most of the carbohydrate intake in the standard American diet is upwards of around 300 grams of carbs per day. That's a lot. If you're on a keto diet, you're usually between 20 and 50 grams of carbs per day. That's very low. And that can be very challenging for people. And then a low carb diet can be anywhere from 50 to 150 grams. And often, if you talk to a primary care physician or specialist, they'll say, the Mediterranean diet is sort of the best studied diet, and it's the way that most people should eat. That can vary in carbohydrate intake from 50 grams all the way to 150 grams. It's kind of a low carb diet, but it can vary depending on what you decide to include in a Mediterranean diet. So then there's carnivore. We have absolutely no carbohydrates at all. So these are like nutrition tools that you can use to sort of target the food component. And then there's like hacks within the food, whether it's the order you eat your food, right? So if you eat carbohydrates in your diet, but you put them at the end of your meal, they have much less impact on your glucose and much less impact on your insulin. So food order is a hack we can talk about with patients. If you eat fibrous veggies up front, it will slow that glycemic load of any carbohydrate you have afterwards. Adding vinegar to food will do that as well. And then sometimes with starches that you're going to eat, specifically potatoes, if you heat it and then cool it and then eat it, reheat it, it actually becomes more of a resistant starch and has a less glycemic impact on your body. So these are just little hacks that doctors are not going to talk to you about. Even dietitians don't always talk to you about.
I'll be darned. That's actually how I eat my potatoes, but it was just by accident. I didn't.
Leftovers, right? Leftovers have a benefit.
Okay, so nutrition. What else did you talk about?
So we usually will target sleep. Sleep is a big one. And I talked about this with a client today. She's like, if 95% of our serotonin that we make in our body is from the gut, which it is, and our gut microbiome is disrupted, how are we going to sleep? Because melatonin is made from serotonin. And if you're not making adequate serotonin in your gut, you're probably not going to make adequate melatonin. You're probably not going to sleep really good. So getting your gut health in order to get your sleep in order, they're so intertwined. And so we'll talk about sleep, but we'll have to include the gut and how to help heal the gut if you're having gut issues or dysbiosis, trying to get your gut bacteria livened and enriched. The other issue is, how you sleep. Sleep hygiene we talk about. So trying to avoid screens before bed, sleeping in a really cool room. You want to avoid liquids before bed so you're not getting up multiple times during the night. And then there's a couple of hacks that I'll use with supplements to help patients get a better, deeper sleep. And they're supplements, so they don't feel like they're being sedated. There's usually a magnesium component, an amino acid component, and it's just helpful for cell signaling and for relaxation. And it kind of preps your body for sleep better. And those can be nice little add-on tools for someone who's like suffering and not getting good sleep. Because if your sleep is disrupted, the following day, your cravings are going to go up, your hunger is going to go up, your stress cortisol levels are going to be higher, and that means your insulin is going to be higher. And so sleep dysregulation alone can lead to significant insulin issues.
I did not realize the connection between bad sleep and elevated hunger, but
Yeah.
just thinking about the last couple of months, I've been fighting some low-level sickness. And on the nights that I don't sleep well, I wake up voraciously hungry and feeling significantly worse. I'll be darned. Okay.
Yeah. And night shifts, when in the ER, if I work in a night shift that following day, especially wearing a glucometer, I've got the new lingo on today. You can see in real time what's happening with stress or with the high cortisol from a poor night of sleep, which
Wow.
brings me to glucometers. So that's another
Yeah.
tool we'll talk about. So sometimes it's easy for your doc to say, well, you shouldn't eat this, you shouldn't eat that, and ultra processed foods are bad, or stay away from too much bread and rice. But when you put on a continuous glucose monitor, just to kind of gauge, just take a peek inside the body, you're going to get a really good sense of what your individual body responds to. And it's nobody telling you what you can't eat or not eat, because you're seeing in real time as your sugar changes with what you eat, if that's actually a good enough food for you. I have a client I can do hummus, but I can't do rice. He says, if I have rice, obviously I'm like way off the charts, but hummus I'm good with. And his partner, his wife, is the exact opposite. No change at all with the rice, but with the hummus, it's out off the charts. Or he can have these little mini ice cream cones, which I'm sure this is going to make my, glucose go up. And it kind of didn't budge at all. And it's probably because they're small and they have a very low, glycemic load because it's a small portion of something. And now he knows I can have that occasionally and it's not going to spike my sugar and cause my insulin to sort of concomitantly go up. So having that little biofeedback tool to peek inside your body is super cool. And you can do that on your own. You don't even need a doctor now. Those became over the counter this past summer. And yep, they are
I,
offering them. You can buy them
I
online.
totally did not realize that, but I've done it once. It was still by prescription only. So
Yeah.
that was fascinating. Okay.
So we targeted nutrition, sleep.
Yeah.
Stress is the other one we'll talk about. I have a client who was 27 years at JP Morgan, burning the midnight oil for years, decades. And we did a food log, and his food intake was actually pretty clean. He had a lot of dinners out, but they were fancy dinners because they were high-end clients. So we'd have steak and vegetables, and it wasn't terrible, maybe a few too many desserts. But his hemoglobin A1C for diabetes was like 6.4, 6.5. So he was full-blown diabetic, but it wasn't from a diet issue. And for him, it was purely a stress-related issue, and it was his work-life balance.
Wow.
And those are patients we'll talk about meditation. There's some cool apps that you can download that you can learn how to meditate on your own. We talk about yoga, breathing exercises, sometimes retreats if you can afford something like that, but ways to sort of train yourself to learn to decompress. And that is one of the hardest things, I think, for people to do, because they don't feel like it's your job. Like, this is the thing that I have to keep doing, or the stressors in your life aren't really easy to control. But stress causes cortisol spikes. Cortisol spikes cause insulin to go up. Insulin up is metabolic dysfunction. It's hyperinsulinemia. It leads to diabetes, all the things we just talked about. So it's a huge component. There are a couple of supplements sometimes I'll talk about that are like a little controversial. They're not super well studied, that can sometimes help with cortisol levels, like ashwagandha or stress. But a lot of the ways we cope with stress are better managed when our sleep is good, our nutrition is good,
Yeah.
and then exercise. So that's the last pillar, is exercise. And if you're exercising, we tell patients, really, it's not exercising for weight loss. It's not exercising to get yourself healthy. It's for stress management, and it's to build muscle, because those are the things that are actually going to improve longevity and health span as you age, not necessarily to lose weight. But exercise is super important. I will say it's one of the harder things I can get. I have the hardest time getting patients to exercise. I happen to have an older clientele that I'll see. So either it's a generational issue or they've just kind of been sedentary for most of their life, but exercise is not a regular part of their daily regimen. So we have to start with very simple things like, this is band workouts. Like, how do you stand in your kitchen doing chair squats, holding onto the counter and doing lunges, using some stretchy bands in a chair, just to start with some resistance training. But those are going to be key things we tackle after we kind of grab these other pillars and get them in line. Yeah.
This is a really good summary. People will focus on something really highly specific, but this is very foundational. So I appreciate
Right.
this. All right, let's talk about your practice in particular. These are
Sure.
always fun. Common complaints, common compliments. What do you hear a lot of on both sides, on the extremes?
I guess, I mean, the big complaint is often the exercise. Right? I mean, I hear complaints from my patients, which is why they're often seeking me out, is that their doctor doesn't listen to them. They don't have enough time. Oh, or they're very condescending or more patriarchal about sort of the advice that they're giving. So it is, I'd like you to take this medicine and now you're going to be on that for your life. And there's not a lot of discussion about what does this look like? What's the cause of this? How long will I need this? What can I do to maybe get off of this or stop taking this medicine? And physicians are not trained to take medicines away. We're really good at putting them on, but deprescribing medications, that is a whole course in and of itself that we are never given in med school or in our training or in life. So I think that's the thing I find patients are most frustrated with. And it's the lack of access, the lack of time that docs can spend with the patients. And that's just the system that we live in. The healthcare
Yeah.
system is not designed to give a lot of time. So the things that I get complimented on are I do spend a lot of time with patients. Our first visit is 2 hours. And that's with a questionnaire I send to them before we even meet so that I have some baseline. And then we go through that questionnaire in detail. And I want to know who's in the house, who's cooking, who does the shopping, who's helping you, who's hindering you, who's sabotaging you, where are your stressors coming from? What medical issues have you had before? What diets have you tried? What kind of exercise do you like? Do you not? What foods will you not eat? What foods will you eat? That's a lot to get. And there's no way, even a dietitian or nutritionist who sits with you is going to spend that much time. So we do a nice long first session, and then every couple of weeks we meet again for another hour. And it's to check in on the things that we've kind of laid out to tackle. So patients feel like they're getting one-on-one connected with their doctor. And I provide access for them as well. So I text with my patients. I'm available by text. There's no middle person. There's no PA. There's no NP. There's no MA. There's no nurse. It's just me. And so when they text me, they're texting me, and they can text at all hours. I may not get back to them at all hours, but I typically will respond pretty quickly. And I think that responsiveness makes them feel reassured so that if they have to adjust a medication in real time, I'm right there to tell them how to dose it. If they're feeling dizzy, I've had patients with dramatic improvements in blood pressure. We've had to draw down their blood pressure meds pretty quickly. I've had patients on insulin that we've had to dial that back really fast as they make these changes. It's like super exciting, but it's also dangerous if they don't have access to somebody to help them.
Yeah.
So I think the access is key. That's something they love. And that one-on-one kind of meeting patients where they're at and working with them so that we'll talk about a couple of different tasks each time we meet. And then if they're not working, we pick new tasks, we pivot, or we'll try a different tool. I have a patient who tried keto for 3 months, didn't lose any weight. He tried carnivore, he gained 20 pounds. And then we started doing alternate day fasting, and he's 50 pounds down in 6 months. That's the tool for him, not the other one. So it's just sometimes it's trial and error. And it's also about what you can do in your lifestyle, what you don't want to restrict or what you do want to restrict. But there's not one panacea. It's not just cut your calories and exercise more. And this is what we tell patients. So I think that's sort of the benefit of this practice that I have. And unfortunately, I'm just one person. So I can't see a ton of patients, right? I can only see a small little cadre of people.
If folks want to learn more about what you do and how you do it, what's the best way to do that?
I have a website. It's actually getting revamped right now, but it's up and exists. It's www.toolkitmd.com.
Toolkitmd.com. All right.
Because I'm all about the toolkit. There's lots of tools for lots of problems.
I like that approach. That seems like a really practical approach. All right. So we'll make sure that information shows up in the show notes.
Sure.
This is my favorite question, the billboard question. You've got to deliver your health information, but you've got no more than 8 words to deliver it because people are driving by at 70 miles an hour.
Mm,
What's your billboard say?
I've thought about this. So 8 words, right?
No more than. It can
Okay.
be less, but it can't be more.
So lifestyle matters, invest in yourself, and give yourself grace. That's 8 words. That would be my
Lifestyle
mantra.
matters. Invest in yourself. Give yourself grace. You came
Yes.
in under the wire.
Yeah, I
All
think those are
right. Our
important.
guest has been Dr. Seneca Carrillo. This has been the Predictive Health Clinic. I'm Jack Heald, and we'll talk next time.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.